Hello everyone. Today we are going to discuss on the topic called regenerative endodontics. Coming to the introduction, the regenerative endodontics focus on the biologically based procedures designed to replace the damaged structures, including the dentin and the root structures, as well as the cells of the pulp dentin complex. Basically, it's a procedure done to form a root and completion, and then replace the pulp dentin complex. The key terminologies which we need to know about the revascularization is the revascularization is the restoration of the vascularity to the tissue or an organ. The term repair is called as a restoration of the tissue continuity without losing the original architecture or functions. Revitalization is the ingrowth of a vital tissue that does not necessarily resemble the originally lost tissue. So the goal of the regenerative endodontic is to primarily to form a root and completion and then maintain the periodontium and then maintain the healthy state of the tooth, offering a hope for the retaining of a natural dentition. So this is the concept of this tissue regenerative endodontics is a concept based on the tissue engineering. It's an interdisciplinary field. The tissue engineering combines the principles of life sciences and then engineering to develop the biological substances. The function is to these substitutes are designed to restore, maintain, or improve the function of the tissues or whole organ itself. So, key figures in this field include the Langer and Vacati. These are the two people who worked on the regenerative endodontics. And then triad of the tissue engineering includes stem cells. Their stem cells is the sources of new tissue, and then the scaffolds. The scaffold is the structure to support the cell growth. And then third one is the signaling molecules, which is the factors that direct cells differentiation and growth, which is all influenced by an environment factors. For the regeneration to occur, the components must interact within an optimal environment and the time frame. Stem cells and progenitor cells. The definition of this thing is stem cell is undifferentiated cells which is capable of differentiating into various specialized cell types. The classifications of classification is based on the potency. First one is a totipotent, which can differentiate into any cell type. For example, it can either can differentiate into zygote, and then pluripotent mean it can form any of the three germ layers, but not the entire organism itself. The multipotent is a limited range of differentiation within a specific tissue. Example, hematopoietic stem cells. Another classification is based on the sources. Autologous means which is from the same person, allogenic is from the same species, xenogenic is from the different species, and then isogenic is from genetically identical organisms. And then dental stem cell Nikes. So dental pulp stem cells were the first population described, originating from the ectomesenchymal cells during the embryonic development. There are the specific types of dental stem cells, which include the scap, which is called as the stem cells of an apical papilla. The DPSC is the dental pulp stem cells. Shed is the stem cell from the human exfoliated deciduous teeth, and then PDLs are the periodontal ligament stem cells. And then IPACs are the inflamed periapical progenitor cells. BMSCs are the bone marrow stem cells. The Nike include that the stem cells are maintained in a quiescent stage within the specific microenvironmental until the needed for repair or regeneration. And then these are the places where the dental stem cells are present and then where it gets originated. The dental pulp stem cells are mainly present in the dental pulp. It can also be extracted from the wisdom teeth or any primary exfoliated primary teeth. These cells are multipotent in nature, capable of inducing a dentinogenesis, which helps in the formation of a dentin. The mineralized matrix within the tubules are lined by the bones, and then they also helps in the regenerative of our tissues like a pulp and periodontal ligaments. The periodontal ligament stem cells, it's are harvested from the enzymatically digested periodontal ligament. It can regenerate into a cementum like lined with collagen fibers, similar to Sharpie's fibers. Isolated PDL stem cells can be cultured or expanded, differentiated into different cell types. Stem cells from the apical papilla. These are originated in the apical papillary region. These are also multipotent in nature. Apical cells are rich. This zone is rich with the lot of stem cells, and then it has the stem cells for apical papilla and the pulp. These can undergo odontoblastic, osteogenic, or neurogenic differentiation, so that it can form a dentin, bone, and then nerve fibers. Coming to the growth factors, it is also called as it act as a signaling molecules and morphogens. These are the biological factors which stimulate the differentiation of the mesenchymal stem cells. The mesenchymal stem cells which can use a ratio of odontoblastic like cells. The function is to stimulate the division of the neighboring cells. The PGDF is one of the growth factor which helps to stimulate the division of the neighboring cells. The BMP is another growth factor helps in stimulate the differentiation of the certain cells along a specific path. And then it is to stimulate angiogenesis and has to serve as a chemo attractant for the specific cell receptor types also. And then here comes a few other growth factors. I mean, the BMPs include the FGBFS, TNF, TGF, IGF, EGF, IL, PDGF, NGFs. And then these are collectively helps in the embryonic tooth development. The mechanism in which the growth factor works is it helps in the recruitment of the stem cells by a mechanism called chemotactic. It acts as a chemotactic agent and then attacks into the injury site. It helps in the cellular proliferations. The growth factors like AGF, PDGF helps in the cellular proliferation, signals stem cell proliferation. And then angiogenesis is the development of the blood vessels. VEGF stimulates the formation of the blood vessels. Also, the cellular differentiations factors include BMP, TGF betas, signal the stem cells to form into an odontoblast. Matrix deposition and the tissue remodeling. Dentin deposit stalls, MMPs facilitate remodeling of the new matrix. And then the third important one is a scaffold. It's a 3D structure that containing the growth factors. It has the following functions. It supports the cell organization and vascularization, aids stem cell proliferation and differentiation, leads to improved and faster tissue development. It contains the nutrients to promote the cellular cell survival and growth. May also contain antibiotic and prevent the bacterial ingrowth into the canal cell. And all mechanical and biological functions. The scaffolds, it's available as a natural and then synthetic. Natural scaffolds include collagen, platelet-rich fibrin, glycosaminoglycans. The synthetic ones are PLA, like polyglycolic acid, polyethylene glycol, and then PCA. And then apart from the triad, the proper environment should be available for the regeneration to occur. It has to be a microbial penetration and then defense responses. The zone should be sterile in nature. Microorganisms and their products can penetrate with the dentin matrix and then induces the cellular response in the bulb. Over the time, the microbial load increases, leading to the microorganism being found in the pulp. The role of the odontoblast. Odontoblast plays a key role in the environmental sensing and defense. Odontoblasts have a matrix secretory functions. Their later processes make the extensive network for facilitating communication within the dentin matrix. Microbial sensing, which include the odontoblasts release the antimicrobial peptides and the various cytokines. Microorganisms are detected by the pattern recognition receptors, which is PRR molecules, specifically toll-like receptors. Intercellular signaling. Microbial sensing activates the intercellular signaling pathways like TNFK beta and then p38, MAP kinase, and JNK. This results in the release of an inflammatory mediators, amplifying the defense of responses and the regulating of the immune cells. The procedure, the regenerative endodontix defined as a biologically based procedure now designed to physiologically replace the damaged root structure, including the dentin root structures as well as the pulp dentin compounds. The primary goal is to eliminate the symptoms of the evidence of the bone healing. The secondary goal is to increase the thickness and the length of the root. The tertiary goal is to have a positive response from the pulp vitality. The success of the regenerative goal is to have a histological confirmation for the structural and the functional restoration. And then this is based on the regenerative strategies include cell-based approach and then cell-free approach. In cell-based approach, transplantation of cells to the site of the injury in the tissue to promote the regeneration. It offers a long-term success rate that requires the use of cells of the highest good manufacturing practice quality. The cell-free approach is avoiding the need of directly transplanted cell to the injury site. Basically, the injury site has to attack its own stem cell and then it has to differentiate and then it has to regenerate. It focuses on the providing the conductive environment for the regenerations. Coming to the root canal revascularization, uh, revascularization in non-necrotic tissues in an immature necrotic tooth, it helps in the formation of the root and formation, also to restore the pulp dentin complex. It is to maintain the vitality of the tooth. So, in coming to the necrotic teeth with open abasis are the one where it can be revascularization can be. Some vital pulp should be present and then head with epithelial loose. Pulp proliferation once is disinfected. Revascularization is opposite to apexification, which is based on the calcium hydroxide or MTA. Indications of revas include the teeth presenting symptoms of chronic apical periodontitis, immature apex or blunderbuss canals, wide canals or parallel walls, non-vital on pulp sensitivity test. So the clinical procedure includes in the first appointment, the anesthesia should be given and then the tooth should be isolated and then access opening is done, and then we don't use the endodontic files here, we rather use a sodium hypochlorite 5.25% is preferred, and then it is activated inside the canal and then all the necrotic tissues are removed, and then using a paper points the canal is dried, and then the working length should be 2 mm above the foramen, and then you can have a triple antibiotic paste as an intercanal medicament, and then closed dressing is given. So this is the clinical procedure done in the first visit, and then patient is asked to come after 3 to 4 weeks. So the second appointment, you check for the patient how he is doing, how about like pain. So there is no symptom of active infection, then the same procedure has to be followed for the second appointment also. The extra thing you will be doing is you will be using an endodontic file, and then we'll be going 2 to 3 mm above the apical foramina into the apical space, and then we have to induce the bleeding. And then the bleeding, no, it should be at the level of the 3 mm below the CG in order to avoid the staining by the blood. And then we have to leave it for 15 minutes. And then the chamber is enclosed by materials like MT or biodentin, followed by a GIC and then a restorative components. So the scaffold, it can be the blood clot act as a scaffold, and then we can use synthetic scaffolds as well, like it acts as a source for a nutrient, so that there will be a penetration of the stem cells from the apical papilla, and then it gets all the nutrition from the scaffold, and then the environment to provide the provided else is the regeneration. So the patient is called after 6 months to 1 year time. For the success of the revascularization is depend upon the there should not be a lack of the patient should not have any symptoms, and then there should be radiographic evidence of root and formation, and then the advantages of reverse include the short time duration is an inexpensive shortening, strengthening of the lateral root walls, autologous grafts causes of immune rejection, observational root canal is not necessary. The disadvantages include the composition of the cell in the fibroid is unreliable, crown discoloration, development of the resistant bacterial cells, canal may get calcified the cell